I'd like to call to order the Joint Health and Human Service and Records and Public Safety Committee meeting of Wednesday, August 16th, 2003. Can we please rise for the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to item 3, if I can get a motion to adopt the agenda.
Romano adopts the agenda.
Support.
Please call the roll.
And Sickle, yes.
She's sticking with that, call the roll.
Motion passes 11-0.
Item 4, approval of the minutes. Motion to approve the Joint Health and Human Service and Records and Public Safety Committee minutes dated July 19th, 2023.
So move, Perna.
Seeing no speakers.
Yes.
Now we'll move on to item 5, which is public participation. This is the first opportunity for public participation for those who wish to speak for a maximum of 3 minutes on any item on today's agenda. There will be a second opportunity at the end of the at the end of the meeting for those who wish to speak on any issue. Would anyone wish to speak at this time? Seeing no one, we'll close public participation and move on to presentations. If I can get a motion to receive and file the Martha T. Berry scheduled report.
So move,
Hello, Mr. Evans, how are you today?
Great, Commissioner Lucido, thank you. You have a presentation ready for me, or you do not? All right.
There's Sarah.
So today, I just wanted to, before we get into some of the nuts and bolts of what's happening at the facility, just do a quick reminder of why we do what we do and have some great information that you've probably already seen. These are letters that we received from family members thanking us for the work that we do. This is over at Goldenberry, which is the adult caring center that we supply staff for on behalf of Macomb Community Action. We have an agreement to provide that and to run that facility on their behalf. Just some really nice comments there. This is something that really means a lot to me because our staffing levels, because we have better staffing levels than most of the state and nation, even though we have less of what we want, we are able to do more than most facilities. In this instance, this was a gentleman, the gentleman that actually drew these was becoming more despondent because his wife was there and he moved in, and his wife was not able to recognize him, and so he got sad about it and was becoming depressed. So our activities team pressed in and found out that he used to like to draw when he was younger. So they got him some canvas and pencil, and on the left-hand side, drew a picture of his wife when she was younger. That was in about 10 minutes. And now he is drawing pictures for everyone, including someone that he had a conversation with that liked politics, JFK, and somebody like Star Wars drew that baby Yoda for him. I don't know if you know who that is, but making life worth living is so important to what we do. Also, even though we manage mostly people that are there long-term and highly, highly skilled, it's always a joy to be able to celebrate people going home. In this case, they celebrated us. The Cusumano family celebrated us for the work that we did for their mom. And it's really exciting to be able to make a difference. We make a difference because we are different as a county facility. I'm pleased to say that we're right now at 96% census. We have 209 souls that we're serving. The state average right now, according to the Healthcare Association, is 83%, so we're helping bring that number up. The other thing that's important to remember is that in these instances, still we have 2 to 1 where other facilities are discharging from their facility to us because of our staffing levels and our acuity ability to manage that acuity. You can get some Medicaid in other places, but the most difficult Medicaid cases come to us. And I'm pleased to say that our efforts have resulted in what you see right there, where when I started in April 11th of 2016, we were a 1-star facility, everything except for staffing. And I'm pleased to say we're at 4-star across the board. If you look at the quality measures where we're 4-star, that's a combination of long and short-term stay. We don't do short-term stays as much because that's not our wheelhouse. We don't compete for the Medicare dollars. And because of that, our short-term measures are lower, which brought that number down. But our long-term stay measures are actually 5-star, which I'm very excited about. Next is the building projects update. In 2016, when I first got here, the facility was in poor condition, no doubt about it. It was in bad condition. We spent $10 million of our money, none of it from the county, to be able to repair it. I'm pleased to say when Plant Moran Cressa came in, they graded us at fair, and I believe that's an accurate assessment. We have a lot more work to do. Their numbers, though, were high, but at $41 million is their estimate. Plant Moran also estimated that the decisions that the county made hurt us to the tune of $3.4 million, and that was a conservative number. I believe it's higher, but I'll take that number to say, you know what, it's more complicated than just it's your job to do this, and choose not to recognize that decisions that the finance department made impacted us negatively. So we were required to change how we keep our residents secure. Just so you know, we use magnetic locks throughout the building. And then in the event of an emergency, a fire, those, what they call fail open, which means as soon as the fire alarm is pulled, all those become open. The fire marshal supervisor, Jerry Rodabaugh from the state of Michigan, came and we were contesting the citation, and he said, truly, this is the safest building that I have seen, but it doesn't comply because anybody at any time should be able to get out of any door 24/7, 365. So we have to retrofit the entire building. And if we just did that without any communication, we could do it for roughly $600,000, but it would not keep the residents safe. So we have to connect it to our communication systems so that if somebody is at a door down one hall, we have all hands on deck notifications. And that causes significant cost in that. But I could not in good conscience just do the minimum requirement and put the residents, especially in a 3-story facility. There have been deaths for those that did that, and I would not want to be one of those people that become another statistic, our resident become a statistic because of what I believe is an inappropriate manifestation of a code violation. So we also have already replaced 3 boilers and all retention tanks, but we need to replace 4 more. One of them is cracked and will not be useful at all for the fall. So that's going to cost us roughly $500,000 to be able to correct that. And those boilers directly are our HVAC systems boilers. So we will not, if we do not replace those, then we will not have the hot water and the systems for our HVAC and our whole ventilation, heating, and ventilation air conditioning system. So we already have, I'm sure you already read this, but I'll just give you a brief overview. This is all in the Cressa report that I know all of you received too. But we've replaced lighting on the main floor with LED. The nice thing about that is all of our efforts on going green in this has lowered the cost for us, or actually didn't lower the cost for us. It's lowered the cost for the county entirely. And you might say, well, why aren't your green efforts affecting you directly? That's a great question. It is because we get billed by square footage, not by actual usage. So our square footage is divided by the entire county on their energy costs. So we're helping the county save money, but we don't get a direct benefit from that. But we just feel 2 things. It's a good thing to do because it's the right thing to do for saving money. And also we want to be a good community partner. Something else that's important for you to note, because we can self-perform many of these repairs, our estimates are significantly below the costs of what Plant Moran Cresta says, because they assume that every program has a general contractor that is going in on that, and we don't do GCs and all those. We self-perform in a lot of it. So we also piggyback on a lot of the contracts that the county has already used. So our board, we communicate with our board to let them know when we'd like to do that. As recently as the door access control, those doors access control actually were the same ones that Comtech uses. The video and that platform was the same one that they used, and also the jail is using on their upgrade. So we're doing that intentionally so that Comtech and the jail, if they have an untoward event there, they can gain access with just a passcode and be able to access our external cameras to track, the bad actors around our building. And there'll be no problem with integrating that once they all have the same. So, no question, the public health emergency hit us financially hard. If you talk to your constituents in other facilities, you will know that they are having really difficult times too. One of the best facilities locally is a friend of mine. They don't have the staff, and they don't have a full retinue of their beds full because they don't have enough staff. And they're 60 to 90 days behind on all of their contracts. And there are some facilities, as I shared before, they stopped paying health insurance in the long-term care and said, get it from the exchange. I just had a town hall meeting with family and residents, and one of them was a resident at another facility. One was an aide at another facility, and said this is the best place that they've ever seen. That they had to bring, actually, the resident said, had their family bring in washcloths so she could take care of herself because that facility did not have washcloths. I'm pleased to say that when we got the employee retention credit, we used it to catch up on some of our bills, but mostly to make sure we stabilized the workforce and got in front of it so that we could, when the county, or when the state finally reimburses us properly, we'd be in good position. We're hiring many of the people that were formerly agency because they've seen the other facilities and said, we're the best place to work. So we're now getting close to what we need for our CNAs, so much so that within 2 weeks, we believe we will have pretty close to eliminated agency in our building, which is unheard of in these times. Let's talk about the state paying us. As I shared with you before, costs have been significant. And by the way, when I was talking about the challenges that the other facilities had around the area, don't think that I'm besmirching them. They didn't get money. They were supposed to get reimbursed for their costs, but got 2.5% increases when in 1 year we had 9%, and the second year we had 12% inflation, right? Each of those years, all of us got 2.5% on our rate. And everybody was struggling. We are no different. So I had to do a lot of things, including repurposing full-time staff into different positions. A number of positions that I would like to have, I froze because I couldn't hire them because we just didn't have the money for it. Our cafe, which is one of the favorites of our staff and our residents and their families, we've dramatically reduced that because we had CNAs working down there, and we put them up on the floor and reduced hours there and staff there so we could focus on care and reduce cost. There's many more things that we did, but I don't have time and I don't want to bore you with all of that. But the idea is we were losing money absolutely this year because of we still haven't gotten properly reimbursed according to the reimbursement structure. The good news is, actually I have a lot of good news, is by the end of this year, we will get some of the what they call interim settlements, which we expect to be $1.6 million. And we hope to get the rest of it in the first quarter of next year. In addition to that, we successfully worked with the Leading Age Michigan, which is a trade association, and the County Medical Care Facility Council to procure 2 grants. One was roughly $30,000, and the other one is roughly $200,000 to help us with our recruitment and our retention efforts. So we can't use that for wages, but we can use it for things like tuition reimbursement to help people, or to help people with transportation. We also have, we can repay student loan debt based on their years of being here. We have, for retention, there's a program that we use that is a non-anonymous survey that we get their information, and they're paying us to do that because they understand that employee engagement is important now more than ever with this current this current workforce. They want to know that they're being heard. And so that software that we already had in place, that'll save us roughly the $30,000. Also, I look forward, we had a great conversation. Thank you, Chair Lucido, for putting the conversation together and putting a team together. We recognize that some of the issues we have right now can be resolved simply by modifying the joint operating agreement, which is not in line with current state rule as it relates to the Uniform Budgeting and Accounting Act. And if we do that, you saw a letter, which I won't go into, that this would all be resolved because the JOA would be in line with state rule. And all of the codicils that happen locally would go away because we'd be in line with the Uniform Budgeting and Accounting Act. And one more thing, a shameless plug, ABC stands for Always Be Closing. I'd like you to know that we do have a foundation event I'd love to invite you to, October 18th at Zuccaro's. Doors open at 5:30. It's a great event, and we'd love you to come to that and see some of the things that we're doing. That is an event that we celebrate some of our staff and volunteers through sharing of our, actually they get voted Shining Star, Unsung Hero, which is our clinical and non-clinical employees of the year, and then the Henry G. Berry Award for individuals that have made a difference in the community on our behalf. So love to have you there. It's a great time, and it's a really relaxed atmosphere. And tickets only are $60 a piece. So I think we're the cheapest fundraiser here we have besides bake sales. Thank you again for your support in the community. Martha T. Berry is doing an amazing job. Our staff is incredible. Our reputation has done nothing but grow, especially through the pandemic. We are a provider of choice now, and we are also an employer of choice because of the way we've positioned ourselves, because of the culture that we've built of caring, being resident focused. And I look forward to becoming a 5-star facility and coming back and celebrating that with you when that time comes.
Thank you. Anyone have any questions at this time? Seeing none, can we please vote?
I just wanted to say, I've gotten that night open, the 18th. I'm coming.
Wonderful.
Thank you very much.
Thank you.
Motion passes 13-0.
And then we'll move on to item 7. Starting with item A, budget amendment for the Health Fiscal Year Grant Fund, ELC, contact tracing, case investigation, testing coordination, and infection prevention in the amount of $163,000. And we have Mr. Cox here. Can I get a motion to recommend to full board?
Support Nard.
Hello, how are you?
Hello, good afternoon, commissioners. So the first item is an ask for budget amendment in the amount of our ELC dollars, which is our EpiLab capacity contact tracing case investigation funds from MDHHS, in the amount of $160,000. We're asking that to basically, this is just relocating the budget, existing budget funding in order to expense internal service cost. There's no change to the program's total budget, though. I'd be happy to answer any questions with this one.
Thank you. Anyone have any questions? Commissioner Van Sickle.
Thank you, Chair. Andrew,
Yep.
is this the program where they're doing the sensors in the sewer lines?
It is not. This program in particular goes for any type of case investigations through COVID that we can utilize. So it's contact tracing, it's lab capacity, but it can't support the sewer surveillance dollars. I wish it could. I would wish to put some more additional money toward that, but this is limited specifically for contact tracing, case investigation, and testing coordination. And even testing is limited to resources around that working on testing. It's not even the testing lab support that we could also utilize. So it's very specific to what you can utilize it for from the state.
Are you aware of what public service department is doing?
Yes, I am. We
Do
work
you
very
get any
closely.
reports from the state? I understand all the information's rolled up to the state.
We get reports from their service provider for Public Works, and that's how we get that information. So it's a dashboard that we could look at trends and information, something that I think is going to be very important in the future that we invest in and look at, not only for COVID, but for other types of communicable diseases could be very useful from a public health standpoint.
Has your departments taken any specific actions because of information reported?
Yeah, I believe we got notice. One of the things is it's limited to, and part of the need for investment is that you need more sensors, basically more collection points to take samples to really make street level decisions or facility level decisions. Where I see that it could be very useful is for communities or even let's say a long-term care facility, that we could reach out and proactively say, hey, it looks like you got something here. We need to take these steps to try to mitigate that so it doesn't spread within the facility. We did notice that there was some increased activity about a year ago, and so we were able to try to reach out and give those proactive messages on, hey, you look like you have some increased activity. Start thinking about those mitigation strategies.
Now, from the 160,000 for the contact tracing, have you done any specific results of observing those contact tracings?
Could you clarify results in terms of the numbers that we've done, or
Well,
results
you're
of doing
contact. I
contact?
assume you're getting reports or something from the contact tracing.
Yes, yeah, we have,
Okay, so
I don't have
after-
those handy exactly how many we've done in terms of case
So
investigations.
after
but-
somebody sitting in their office gets these reports, has your departments taken any specific actions based on these reports?
Sure. We look at, we populate that data, we share that data. We often get requested from community partners of where are we at? It could be like school districts are very interested. We have a really good relationship with ISD and schools, especially going into the school year. That's a popular subject of how are we looking? We're able to aggregate that data into one report and share that with our partners so they can prepare appropriately.
I'm looking for you to say, oh, we found contact tracing over here and we jumped in and prevented it from spreading or something like that, but nothing like that has happened. You just alert some people once in a while.
I think it's very hard to measure sometimes education that you provide somebody.
Okay.
What did it prevent? If I educate 100 people, how many people did it save from getting that disease is tough to show sometimes. We can give you how many people reach out and how many people we educated, but it's sometimes difficult to show what was prevented based off of our actions.
Well, this is a grant, so I'm gonna vote yes for it. But if you were asking us for $160,000, I would want to know what specific actions save the county problems, save the county medical dollars, save people medical dollars from spending that money. And so that's what I'll be looking for if you come back to us after this grant's exhausted. Thank you. Thank you, Chair.
Thanks, Commissioner.
Commissioner Zinner.
Thank you, Chair. I'm not sure if it's this area or one of the other areas that you have, Andrew, and hello. I thought I saw something about testing for monkeypox, or it might be an investigation, which I looked up, and I don't have your statistics, of course, and it said that it really, in Macomb County, was not really very high, which is, of course, good. But I expect, are you just watching for things? Is that what you're doing here? Making sure things are
Yeah,
under
specifically with
control?
monkeypox, we want to be ready. You know, we want to be ready in case those numbers do start to peak up. You know, it is expected in the fall, probably see some more increased activity is what we're hearing across the board nationwide and from our, you know, state partners and CDC partners. So we want to be ready. Last thing we want to do is be caught, you know, that the community needs these services, needs testing, and they have nowhere to go to get tested. So we're trying to be proactive in that arena for monkeypox, or mpox, I should say.
For anything. So exactly where would someone go for testing?
Well, that's what we're trying to implement. We can do that in our SDI clinic, formerly STD, but now it's called sexually transmitted illnesses. So it's SDI clinic, and we have that in our southern end. And so now we can do testing in our clinic.
So exactly where is that?
That's in our Majestic location in Warren.
Okay, yep. All right, good.
Familiar.
Thank you very much. Thank you, Chair.
Thank you. Seeing no other speakers, can we please vote?
Motion passes 13-0.
Moving on to item B, a budget amendment for the Health Department fiscal year 2022-2023 MDHHS Comprehensive Planning, Budgeting, and Contracting Emerging Threats Grant Amendment in the amount of $326,712. Can I please get a motion to recommend a full board?
So moved.
Support Zinner.
Motion and support. Hello.
Hello.
Again.
Sticking with COVID, this is some forecasting that we're trying to be proactive with. We have, this specific amendment is an amount of $326,712. And then this is specifically our COVID immunization grant from the state. This is going to be spread out. This year we were allocated $873,000. Next year we're getting the same. We are forecasting that it's going to be difficult to expend all those grant dollars. We have money that we can offset with our general funds this year, so we actually asked for the state to actually increase from next year's award and give that money proactively to save us county dollars. And that's this amount of the $326,712 that we're trying to be proactive. We have costs. We don't want to ever turn back money to the state in grant dollars. So this is our way of offsetting general fund dollars and county cost.
Commissioner Nard?
Hi, Andrew. So did I hear you say this is for COVID testing?
This is COVID immunization, so vaccines, vaccine cost.
Okay, so is it going to include any hepatitis? Because I know I remember hearing last year that they had a concern about that in the schools.
I wish it would. You know, one of the things we keep repeating up to the state is flexible funding sources. Our hands are tied with this has to be specifically related to COVID.
Okay.
And so it's earmarked. So I wish I could use it for things like hepatitis A and other illnesses, but I can't.
So do you anticipate COVID being a problem in the school year?
That's a good question.
I mean, that's a lot of money, you know.
Do I anticipate possibly seeing some increased activity? I do.
Okay.
I think we're in a much better place to handle safely, and our hospital and healthcare partners are more prepared. I think we have a better immunity coverage in the community, whether it be through naturally immunity through getting the infection or things like immunizations, which is a really great way to prevent or lessen those symptoms. I do think we're going to see some additional waves, but I think we're in a better place to handle those waves as well. And I think our healthcare partners are as well.
Okay, thank you.
Thank you. Seeing no other speakers?
Excuse me, I
Sorry.
didn't punch the button in time. I was going to Commissioner Nard's comment about a spike in COVID. They said there's a little bit one going on now, maybe in the schools. Right? You meet regularly with, not regularly, but you meet from time to time with the ISD to talk about protocols to deal with COVID after, given our experience through the height of it all. Are we better prepared now to address those issues in the schools if they pop up with hotspots, and are we gonna do something different than we did before, or just tell me talk a little bit about, since we have you here.
Yeah, no problem. I think we're very well prepared and posed. I, selfishly think that we did a good job in the first place. So I think we're gonna do the same job we did before. And to me, speaking to, counterparts around the state or other counties, we had a very unique, positive relationship with our school districts from the health department. That relationship didn't exist everywhere. And I think that is a testament to the partnership of the health department and the schools that we partnered with. We were lockstep with them. They might not have always agreed exactly 100%, but we always were very good at talking with each other. We met once a week with our schools. We're not meeting at that frequency right now, but we can, and we absolutely will if we need to. So are we prepared and ready? We are. We have that relationship. A lot of the ISD we can set up those calls. They know what to do. We do meet with them and keep them abreast of changes. One of the changes will be the new, booster vaccine that will be coming out in the fall. Should be probably this end of this month or October, which will include some of that variant. But we are ready to help them with additional mitigation strategies too. In terms of ventilation is so key and important, something we've learned very much throughout COVID. And the schools know that, and I think they're ready.
Okay, good. Thank you. Glad to hear that. Thank you, Mayor Chairwoman.
You're welcome. Commissioner Zinner.
Thank you, Chair. What is, are children K through 12 or even pre-K through 12, do these children have to be vaccinated to go to school?
So in Michigan, you're required to either be fully vaccinated and have proof of that, which goes into the MDHHS system, or excuse me, not MDHHS, Michigan Care Improvement Registry, which is a registry statewide that the state maintains for immunizations. So you have to be up to date, or you have to have a waiver, and that waiver can either come in a medical waiver for medical reasons or non-medical waiver. You do have to have that waiver in place to attend school, though, if you are not fully vaccinated or up to date. Does that answer your question?
Yes, it does answer my question. And is it hard for parents to get a waiver if they go through these two channels? I mean, are they denied?
So a medical
And
waiver
denied
has to be
access if
filled
they
out
have
by a
those?
medical professional, so they would have to get that medical professional to sign off on that. So they would have to make an appointment, obviously, with that medical provider, which can be, take some time and difficult depending on practices and how far they're booked out. Non-medical waiver, our school immunizations program does handle that. We saw probably our highest number of non-medical waivers last year, one of our highest years ever. Very concerned over immunization coverage rates of our youth and our children. We used to be at around 72%. We are currently at 62% coverage for that age group from 19 months to 36 months, which is very concerning to me as a public health professional.
But the COVID increase is COVID is not increasing during that time period, correct? That we know.
So COVID vaccines are not required they're not a part of that required schedule for admission to school. Is that what you're asking, or you're asking activity?
Activity.
So right now, activity is low.
But I mean, through that time period, the COVID had gone lower, correct, during the school year?
The last,
Was quite
talking
less.
about for immunization rates? The immunization
For
rates I'm
people
talking
being
about different
sick, for children being sick, they had lowered, hadn't they?
compared to adults. Are you talking, in general, a general statement
In
that
general
children
statement
saw
for the children.
lower severe outcomes, health outcomes? That is correct.
And
That's a
amounts,
correct
yes,
statement.
yes. All right, and is there a pastoral waiver also, or not?
There's not one for religious reasons. It
Okay.
is just the medical and non-medical.
Thank you very much. Thank you, Chair.
Thank you. Commissioner Nard.
I'm sorry to even have to ask that, because Commissioner Zinner brought up something that I'm concerned about because of my grandchildren. So did I hear you say that they are required to have a COVID booster to go to school?
They are not. They are
Okay,
not
okay,
required. that is not part of the required, the state sets that
But they
schedule.
do recommend that they
For
do.
vaccines, required vaccines, and the COVID vaccine is not on that list for requirement.
Okay. Is the hepatitis on there? I'm sorry.
It is.
Okay, cool. Yep.
Thank you. Seeing no other speakers, can we please vote?
Motion passes 13-0.
Moving on to item C, Budget Amendment, Health Department Grant Fund, fiscal year 2022-23, MDHHS Comprehensive Planning, Budgeting, and Contracting, LHD Grant, Amendment Number 5 in the amount of $18,461. Can I please get a motion to move to full board?
So move, Hall.
Support Van Sickle.
Thank you, Commissioners. I believe Commissioner Zenner, this is the one that you might have been asking about with monkey mpox. With the amount of what we're looking to do is integrate mpox into our SDI clinics. And when we say integrate, it would be testing capabilities of having that testing available. Last year, we were sending individuals from our county to other providers. Not a lot of providers were providing mpox testing. So a lot of our residents were going to Oakland County or Detroit for testing. We would rather have that capability in-house and provide that support. Felt very strongly about that. And this budget amendment is going to allow us to do that.
Seeing no speakers, can we please vote?
Motion passes 13-0.
All right, and we'll move on to item D, which is an agreement with the Arab Community Center for Economic and Social Services, Special Supplemental Nutrition Program for Women, Infants, and Children, WIC Services, grant funding in the amount of $311,000. Can I please get a motion to recommend to full board?
So moved by Nard.
Thank you, Chair. This last one for me, as much as I like talking about COVID, this one is about WIC, another great program at the Health Department. So this is actually a great partnership we have with with Access, a great partner that they provide WIC services in their community, especially to our American partners and Arabic-speaking residents in Macomb County, very important. We do have obviously our existing WIC services that we provide at our 2 locations within the Health Department, but this is for specifically the Access location that they conduct WIC services. This was bid out in 2019, and it was a 3-year with the option of 2 one-year extensions. This is the first year of that extension, so there'd be 1 more next year. Which after that we would obviously go out to bid. In 2019, Access was the only one that did bid on the services when we did put it out for bid.
Thank you. Commissioner Nard.
Quick question. Now I know this is the Arab community, they're getting this money for their WIC program. I just wanted to ask, I was gonna call you about this, but since you're here, I'm gonna go ahead and ask. I was speaking with some people in one of the food pantries on the south end, and they're saying that the WIC program is no longer available in South Warren. I think it was on HUP. What could I do to rectify that problem? I don't know what happened that they didn't open back up after COVID.
So if you want us to offer WIC services, we'll do it because they're there now.
Okay.
I think some of the confusion, Commissioner, is that there was a waiver nationally, federally. WIC is a federal program. Mm-hmm. And there was a waiver for them to do services remotely by phone.
Okay.
Our clients actually, most of them prefer it. It's easier for the moms than lugging the stroller and the baby for their appointment. However, the federal program feels very strongly that you miss some of that interaction and assessment, which is probably true. It's less convenient though for our clients. So throughout that waiver, which just ended, they are now fully in person, and all appointments are in person. So they are at the Thompson Center on HUP now, and we're also at the Verkulen building, and we're doing 100% appointments.
When did they open back up on HUP?
Just probably fully early July, mid-July. So
Okay,
it's just
that's why.
recent.
Okay, yep.
So that's probably
So
why.
I'll let them know.
So
Okay.
come visit us, please.
Yep.
I think we will see a little bit of a dip in clients because it's less convenient for people. That's the downside.
Okay, thank you.
Thank you. Seeing no other speakers, can we please vote? Thank you, Andrew.
Thank you so
I
much,
appreciate
Commissioners.
all of your time.
Thank you.
Motion passes 13 to 0.
All right, and now we'll move on to Records and Public Safety Committee.
Thank you, Commissioner. Time is 3:40. I'm going to open up the Records and Public Safety Committee. Item number 9 for Records and Public Safety Committee, Department recommendations. Item A is a performance resolution for municipalities, Michigan Department of Transportation. This is no cost to the county. We have Captain Briney here. I need a motion to recommend this to full
So
board,
moved,
please.
Hall.
Support Nard.
I have a motion by Commissioner Hall, supported by Commissioner Nart. He's here. Come on up, Cap.
Good afternoon, Board. Hope you're all well today. Thank you for having me. I came in front of you to get authorization to purchase flock cameras to aid in our investigations about a month or two ago. And you had authorized the purchase of these cameras, which assisted in many investigations already. So it's been very helpful. However, for us to use MDOT roadways, the Michigan Department of Transportation Performance is requiring us to sign a resolution for the right-of-way permits. So for them to give us permits, we need to sign this resolution. I attached the resolution motion to approve the performance resolution with the Department of Transportation for the purpose of issuing Macomb County an individual permit for use of state highway right-of-way and/or annual application and permit for miscellaneous operations within state highway right-of-way. There's no cost. Like Commissioner Romano mentioned, there's no cost. I'm asking the board to approve this performance resolution for municipalities. If some of you aren't clear what the M roads and I roads are, so we have like M19 is Gratiot, M53 is Van Dyke Expressway, M59 is Hall Road, I-94 and I-696, you all know that. In Michigan, the Michigan State highway systems consist of roads numbered within the state of Michigan, and they're signed a number with M or I. So I've explained that M59, M19, M53. Those routes are under the jurisdiction of MDOT. Okay, and then I-94 and I-696. The national system of interstate and defense highways consists of controlled access freeways numbered within the United States and signed with an interstate route number, which is I, and those are also under the jurisdiction of MDOT. So in order for us to put those flock cameras in those areas on I-94, M19, or M53, they're requiring us to sign this, in order for us to get the permits, they're requiring us to sign this motion or resolution with them. So it says that we're gonna take care of the cameras, we're gonna monitor the cameras, and if something happens to them, that's our responsibility. So I'm asking this board to approve this performance resolution for municipalities today.
Thanks, Cap. We got a couple of questions. Commissioner Hall?
Thank you, Chair. Hi, Captain.
Hi.
Did we have to do the same thing with the Comtech cameras?
I believe so, but I wasn't part of that.
Okay, I would just think MDOT would allow us to ride on that same
Correct.
approval. So are you anticipating any problems with MDOT in doing this?
No, this is it. This is our last step right here.
Okay, so
Once
this-
they get this, we're all set. to put
You
them
have
out.
this, you can start installation then?
Yep.
Great. Thank you. Thank you, Chair.
Thank you, Commissioner. I have Commissioner Kraft.
Thank you, Mr. Chair. Hi, Captain. So once this resolution is done, is this something that is just done? Do you have to come back yearly? Is this, kind of a one and done sort of deal?
Well, that's why we're gonna do the individual permit, and that should be it. It should be a one and done, and we have permission to use the flock cameras.
But the
on it.
state's not gonna ask for you to come back to us to approve this, I guess, annually or every 5 years or anything like that you're aware
I'm
of?
not sure if there's a end date on that permit. I don't believe there is, because once they're installed, they're there.
There, right?
Yeah.
Okay. Thank you, Captain. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Van Sickle.
Good afternoon. I assume this is a relatively standard
Yes,
resolution that they asked for?
they're gonna require that from all the departments for that.
Has our legal department reviewed this at all?
Yes, John Shapley did.
Okay, thank you. That's my only question. Thank you, Chair.
You wanna
Thank you,
speak for it?
Commissioner. Seeing no other speakers, please vote.
Motion passes 13-0.
Thanks, Captain.
Thank you, Board.
Item 10 is public participation. It's 3 minutes max per speaker. This opportunity is for public participation. It's for those who wish to speak for a maximum of 3 minutes on any issue. Well, I see an audience of 3 illustrious gentlemen there. I don't see anybody walking up to the podium.
Right, we got rolling.
Well, I guess I'm going to close public participation. I'm going to go to item 11, which is commissioners' comments. And we may not have any of those either.
Might have one.
Motion to adjourn.
Quiet. Jump in. I'm going to close commissioners' comments and go,
There's one there.
oh, I'm sorry, Miss Commissioner Zinner. I
Oh, there's
apologize.
two now.
Mea culpa.
Thank you.
Commissioner Zinner, please.
Yesterday at the legislative conference, I guess it was called, I spoke with, most of us were there, to legislator Chang. I don't remember where she stands in place. And she explained that students have their own ID that they can now vote with for elections. And other groups, which I forgot what she said, someone else might remember, other areas have their own ID and that they can now vote with for elections. There were several different areas now that could vote with their own IDs, germane to where they work, whatever it was. And I was so surprised at that. And when I asked her about this, she said, oh, at the colleges or universities, and I'm not sure how many have this, I was not aware of this, and I try to keep up with these things that they're voting on. There are now election machines or whatever they have. So their election voting is now set up in colleges or universities. And I thought, later last night, I thought, well, gee, we have mail-in balloting now. Maybe some subdivisions need a election machine set up in their subdivision because they can't get out. Maybe the Upper Peninsula should have an election system set up because they have to drive so far that it's hard to get to their town, the nearest town. I'm not particularly happy with that. I think it's more an area for more confusion, more concern, and why not have the state ID and the state and their driver's license? I don't know why there has to be more in this date and this time of everything being so convenient. I just don't get it at all. There's enough concern about things. I just don't get it at all. And many people don't get it, and you certainly don't. I don't get it. And then I saw Eric Smith in the paper again the other day, I think about 2 weeks ago. And he certainly hasn't had his prison time, and he certainly hasn't had his jail time. And I don't know exactly how much longer he has within his situation here, but I think it's getting, the countdown is coming. And if I hadn't had so many citizens talk to me about his crimes and and if I didn't know how it affected the citizens and actually the workers of that department and how it affected everybody in Macomb County, it wouldn't bother me so much. But I do know how it affected citizens. And I just think I just feel something isn't right. Regular citizens would not be getting these allowances as he has, I believe. Thank you, Chair.
Thank you, Commissioner. Duly noted. Commissioner Brown?
On a happier note, tomorrow is our picnic. Selfridge at the Enlisted Heritage House right on the shores of Lake St. Clair. You know, at noon tomorrow, it's going to be the warmest part of the day tomorrow. It's going to be 78 degrees and sunny. So come on out. Don Van Sickle will be cooking our food for us on the third. A lot of things. So looking forward to seeing you and everyone else. So don't forget, tomorrow, 12 noon, Selfridge, come on out and enjoy the day before the meeting.
And it might take you 10 minutes to get through the gate.
If all your paperwork's in order, you go right through. Just make sure everything's, all your T's and I's are crossed.
Yeah.
It'll be fine.
Don't play.
Thank you, Chair.
Thank you. Thank you, Mr.
Commissioner
Chairman.
Hall.
Thank you, Chair. On an even happier note, it is Commissioner Perna's birthday today. So happy birthday, Jimmy.
Happy birthday.
Hey, Jimmy.
Now Social Security eligible.
My thunder, Jim. He stole my thunder.
I got a gift from Mr. Romano here.
Hilarious.
You got the cake. You got to show the cake. Didn't you show the cake?
You can't see
I
the
also
cake.
got you the cake.
Well, the cake is in here. This is my personal cake.
Oh, I'm sorry. Okay. I
No
got it.
sharing
That's for
again.
you, Jim. That's your personal cake. Commissioner Van Sickle.
Thank you. I wasn't going to talk about this, but after hearing Commissioner Zinner mention it, the student voting thing will now allow out-of-state students who have a student ID and foreign students who aren't even residents of the country who have a student ID to vote.
Oh, my gosh.
That's wrong. But what I wanted to talk about initially was, everybody get your bikes out and practice. We're going to have a bike ride September 16th, Saturday, Clinton River Park, North Dodge Park, or Sterling Heights, which is a park adjacent to Dodge Park. Thank you.
Thank you,
We
Commissioner.
watch.
Commissioner Song.
Yes, you can come and watch. You can be at the registration desk.
Thank you. Commissioner Song.
Thank you, Chair. So I'm a huge proponent of voting. I think that, we should make it as easy as possible for anyone to vote and removing barriers. Last year, the voters did vote on Proposal 2 to pass, which would require expanded ballot drop boxes for every 15,000 voters. So that might be what you're referring to, Commissioner Zinner, regarding the locations. As a student, if you go off to college, you can't vote on campus. You actually have to go back to wherever your address is registered to vote. So if that's at home, that's where you would go and vote.
In theory.
That's all I have to say. Thank you.
I think a Pandora's box been opened. Commissioner Nard.
I wasn't going to talk about voting, but, my concern with that is what Commissioner Van Sickle was saying. I want it to be open for everybody that's an American citizen to vote. I'm uncomfortable with it being open to someone that may not be an American citizen. And since we opened up that anybody can vote absentee at any time, then if they're in school, they can vote absentee ballot. I don't like the fact that somebody can just walk up with a student ID, because you can make those at home on your computer. So I just wanted it to be fair, and I understand, and I don't see a restriction as far as that go. I mean, I've been voting since I was 18, and I had to work a lot, but I made it my way to the voting thing. And I'm gonna just put it out here. I don't like the fact that if you're saying you're absent, you can bring an absentee ballot on the day of the election. Because to me, when you say you're absent, that means you're not gonna be there. So if you got time to walk to a ballot on the day of election and drop that vote in, you should be able to go to the voting poll and vote, or either send your absentee ballot in at a certain time. I just don't like all these extra rules, because it worked fine before. Now we're doing all of this, and now we're getting all these questions about that, and that's concerning. And I'm tired of people just want to be quiet about it, because I'm not going to be quiet about something like that. Okay, so now another thing too, I asked, I made a statement that how do we, because people, we're in politics now, and now we have term limits, and so people are going to leave. So when you get a good person that you like, I want to know how we can continue to keep a good person. And I don't know if that question was misunderstood by Commissioner Kleinfeld. I wasn't saying to come in and try to remove somebody out. What I was saying was, when someone has reached their time, say you got 4 years or four-year terms or whatever it is, how are we making sure that we get other elected officials in that we can trust to take care of us going forward? And I like the fact that here at the Board of Commissioners, we have, is it shadowing or government day where the kids came in and did mock interviews? That kind of sparks their interest because I got my interest in the 3rd grade to want to be in a political forum. So I just, I want people to think about that going forward because I know I don't want to be in this all my life. I want to do my terms and then I'm done. And I want to look at somebody or raise somebody up that can do what I'm doing and have the integrity that I have and the transparency that I want to display. So that's why I asked that question yesterday. And I hope nobody misunderstood me when I asked that. So I don't care how, because I'm telling you right now, how will we replace a Don Brown who's a Republican, but he helps everybody on this board? It's going to be hard to replace somebody like that. And I'm just being real about it because he works with everybody. He comes from way up from Romeo where he is, and he'll come right down to 8 Mile and help me if I ask him. And I'm a Democrat, and I appreciate that. And I want to continue to have people like him. So I want us to work with our students so that they can see what type of work this man does. And the rest of you guys are really good. And I want to keep you guys or somebody like you when you get tired of this. So, or your term is up. So that's all I got to say.
Thank you, Commissioner. Commissioner Brown, take that halo off your head. I have a... Commissioner Hall, you have something else to wish Mr. Pern a birthday for?
Yes, I just want to, I don't want to sound like Veronica, but she has for many years advocated, as commissioners, we all have our opinions, we all have differing views on differing subjects. Introducing them here at the county level, when these are actually federal and state issues, does nothing but bring political animosity into this room. And we don't need that. We don't function that way. We don't operate that way. This is county business. All of the stuff that is going on at the federal level with elections, with indictments, with accusations, we each could take a half hour voicing our opinions on all of that. So I would just caution my fellow colleagues, when we get into comments or on issues, if we stay focused to the county, we've all talked about the length of our meetings. We could take county commissioners' comments here until about 8 o'clock tonight, if that's what we want to do.
Looks like
So-
we're on our way. Go ahead.
Yeah. Opening Pandora's box, this, I'm expanding it further. So I would just like to suggest that we all have freedom of speech, we all have our own opinions, but as this Pandora subject was introduced, we could go around the table and we'll all have differing views. So politely, I would like to suggest if we limit our issues to county issues, it would be beneficial to all of us. Thank you, Chair.
Thank you, Commissioner. The box is open. Commissioner Grote.
Just wishing Commissioner Pern a happy birthday. And Commissioner Van Sickle was celebrating his birthday this week on Sunday, so on Monday, even better.
So
Birthday,
happy
Birthday, Don.
Happy birthday.
He may be Social Security eligible too.
Chair Brown, only if you're going to accept the accolades, otherwise you can't speak.
I'm just saying that, we had these heavy discussions about COVID. I got the leftover COVID gel. It's expired. It's expired on 3/22.
Fall off.
Right.
So,
Now what do you do?
Give it to me, Don. I'll take it. I'll take it.
all right,
I'll take it.
okay, all right, good.
Got it?
You have lighter germs than I do, apparently.
Well done.
That was very nice.
Hold on. Commissioner Brown's not done yet. Commissioner Brown.
I'm done.
Commissioner Brown is done. So we have, I didn't get to speak yet. Kraft, do you have someplace to go that you want to adjourn the meeting?
Don't we have public participation?
Item 12, adjournment. I need a motion.
Again?
Commissioner Kraft, supported by
Support Zinner.
Commissioner Zong.
Thank you.
Please vote.
We don't care. Just get it over.
Motion passes 13-0.